Hello and welcome to the Pet Stop. I'm Dr. Brian VOYNICK from the American Animal Hospital in Randolph. Well, coming up on this week's show, why taking your cat to the vet is more important than you might think. Plus, we'll preview a big annual event that benefits a good friend of the Pet Stop. We'll also have this week's Pet of the Week and a visit from Dee Romaho from St. Hubert's for this week's adoption segment. But first up this week, if you're looking to save money on vet bills, experts say it's best for your cat owners to see their veterinarians more often. Cats are notorious for not showing symptoms of illness until it's often too late. That's why regular visits to the vet can help keep your feline friend healthy while keeping your costs down. But taking the cat to the vet isn't always an easy task. And here with some advice on how to make it a lot easier is Dr. Deborah Breitstein. She is veterinarian and co-director of the Animal Healthcare in MARLBORO. Welcome to the show, Deb.
Nice to be back.
Good to see you. Cats are not dogs, that's for certain.
No, they're not. And I'm really inspired to promote feline well care. So our cats deserve the kind of care that we give to our dogs, that we give to our kids. There are other furry family friends.
That's for sure.
Yeah. So we got to get them to see us.
But they're experts at hiding things.
They are. Some people say they sleep 23.5 hours a day. You have to be aware that they can hide illness so well. But we really want to see them, and we have to promote that kind of culture in our practices to encourage them to come and see us.
How often do you think they should be seen?
Because they age differently than we do. I think twice a year is a pretty reasonable well-care interval for most cats, especially as they get older. But I don't want to wait. I don't want to see them as pediatric little kittens with little fluff balls and then geriatric cats without any information in between.
First of all, how do we get them there?
Well, that carrier, you want to make the carrier comfortable, easy to get the cat into and out of, and you don't want to drag out that carrier that's been hiding out in the basement that's nasty looking and doesn't smell good to the cat. You want it to be a comfortable carrying case for the cat.
Yeah, and that's a picture of a cat getting into a carrier in my exam room. You can see the tail didn't want to get in there, but they don't usually go in that easily from home, do they?
No, they don't want to come to us, but once they've been to us, they want to get back home pretty darn quick. Yes, absolutely. And that's a nice carrier that's soft-sided, gives them plenty of visuals, breathing space, and comfort.
Sherpa carrier, yeah, they are good. But some cats, when they see the carrier, get freaked out. So give us some tips on how to ease them into that.
Well, again, you don't want to drag the carrier out from the basement. Leave it around in their immediate environment. Let them get used to the smells. Use things like Feel Away, the kitty aromatherapy that lowers anxiety. A little bit of catnip, cat treats, something that makes that carrier a familiar part of their environment day to day.
It's a good idea to put something very special, out of the ordinary, such as a sardine or an anchovy or something like that, in a dish, in the carrier.
Just remember to clean it up, because if you drag that out later, it's not going to smell too good.
No.
But you do want to make sure that it's a comfortable carrying experience. Cats don't ride in cars very much. You don't take them to the park. They don't go on leash walks. Not many cats do, at least. And so you want to get them used to that as well.
Yeah, it's true. Some people just can't get them into the carrier for one reason or another. And one thing that usually works pretty well is a pillowcase, just to orient them to get them into the pillowcase, put the pillowcase in the carrier, and then lift out the pillowcase.
Kitty burrito, too. Wrap them in a towel and just drop them in gently, and this way you can roll them once they get in the car and get to the office.
And let gravity assist you, because a lot of these firm carriers, if you put them upright, you can put them in, that way. Of course, they'll do anything they can to spread their legs out and avoid it. But
you want to make sure too that you do give them the opportunity to get comfortable in the surroundings that they're not very comfortable with. Make sure our veterinary teams have to be aware of the special needs for cats too. They're not small dogs, so we do have to be a little gentle, a little quieter, a little slower, non-slick surfaces once they get to us.
Right. And oftentimes it's said that they are masters of disguising illness, and it is true. I mean, you and I see it all the time. If there's a cat in heart failure, they're not going to run after a mouse. They're going to assume the pose and the threatening gestures and all that stuff, but they're not going to kill them. So if a dog in heart failure sees a squirrel, boom, it'll drop dead.
Right, exactly. Our cats are generally, they sleep, they recline, they keep their energy expenditures to a minimal, especially if they're sick. But most people think that's an aging process that's natural and normal. I mean, you've had a geriatric cat, Moonstruck, who lived to be 28 plus, and I'm sure Moonstruck had some bad days, but mostly great days where, if Moonstruck needed to do something, go jump up to the perch, she probably did.
Yeah. And how about the actual visit? How do you handle the kitties during the actual visit?
Well, we'd like to have separate waiting rooms. We don't in our hospital, but we do try and escort the cat and their pet parents into the exam room as soon as possible. Cats are not used to seeing and hearing barking dogs, so you get into a quiet exam room, let them calm down a bit, don't yank them out of the carrier. Use gravity, as you said, to allow them to get their footing, and then work slowly, comfortably, and confidently amongst them, because they'll hiss, they'll complain, but we have to make sure we get our jobs done too.
Right. You had mentioned earlier that you're looking to see them ideally, especially as they get to 7 and older, twice a year, because so many changes go on. I mean, if they lose, for example, 6 or 8 ounces of weight, that may not be very significant to the owner, but it's very significant as far as proportion of body weight. And there could be a thyroid issue, kidney failure, there could be a lot of things going on.
And those are difficult and expensive items to treat. These are long-term health concerns that perhaps we can prevent if we had some information to trend sooner rather than at an endpoint. Be proactive rather than reactive.
Absolutely. You know, you and I and a lot of veterinarians throughout the state have seen cats that have come in sick and they're old and they haven't been seen for a few years, and then you don't have trends. You don't know, has this weight loss happened within the last 6 months? Has it happened within the last 3 years, and so on?
The owners don't know
You don't
that
know
either.
the status for leukemia, for feline infection, immunodeficiency virus, FIV. So it makes it really difficult, and then all of a sudden you have to put all these diagnostics on all at one time. And
that adds up
hurts,
to a lot of money. That's
Yeah.
why we try and encourage from the pediatric point of view. We don't want to ignore them after they're spayed and neutered. We want them in at 10 months, for instance, for a nutritional check. They're likely to gain weight. We want to see the trends. We want to see them. We want them to be comfortable seeing us, and we want to be there for our cat-owning pet parents.
Right, right. Not to mention, during the routine physical examination, periodontal disease is so important in cats and so painful for them.
You mean kitty breath isn't normal?
Unless they just had a sardine.
Right, there you go. But you're right, there's a couple of things that we really can jump on and get involved with to be a better healthcare provider for our cats. Dental disease, starting early, teaching pet parents how to brush teeth. Again, being aware of weight changes, coat condition, grooming, pain. Pain is underappreciated in
Feeling
cats.
lymph nodes.
Lumps and
abdominal,
bumps,
yep,
vomiting and
palpation.
diarrhea, all the questions that we ask, we need to ask them frequently so we know what's normal for this cat and how to treat the problems that come up.
Thanks, Dr. Deb. See your vet at least once a day, and ideally once a year, ideally
Once
twice
day?
a year.
My cats do. Thanks, thanks very much.
Good to see you.
Thanks.
Folks, after the break, get your running shoes on. We'll look ahead to a great event that will help one of our favorite animal organizations here in the state. We'll also have our Adoption Zen Pet of the Week, too, so stick around. The Pet Stop's coming right back.